And hello and welcome to our second Lipedema Patient Roundtable. Well, we don't have a table. We're living in a virtual world, and at least we don't have to wear masks during this event today, right, everybody? I am Brenda Viola. I work for Medical Solutions Supplier and Lympha Press, and I've been honored over the last couple months to get to know some of the leading voices in the world of lipedema. And so I want to introduce you to our panel. We also are waiting for one more friend to join us, but in the interim, now I don't know how you're seeing everyone, and I can't do this right. So I want to say the very first person I met in my journey was Pattie Cornute. She runs Lipedema Fitness. Pattie, we're so glad to have you here today. We have Lipedema Living. Lipedema Living is Siouxie Boshoff. Siouxie, welcome. Thank you for being here. On my screen, where probably, which Brady would it be? Would be down there. Cheryl Scoledge, who runs Lipedema and Food Sensitivities, the Facebook page, the artist formerly known as Lipedema and Food Intolerances. Cheryl, thank you for being here. Everybody knows the beautiful, pale Ginger Pear. Everybody loves to follow you and hear about your journeys. Say hi to everybody, Cara. Yes. And we are so delighted to have Dr. Lindy McHutchison with us. You said when I pulled you, we want somebody, a medical professional at the table. Now, we are not dispensing any medical advice today, but we hope to offer some insights, satisfy some of your curiosities. And if we don't know the answer, because we sure don't know all the answers, we'll simply say, I don't know, but we'll get back to you as soon as we know. Dr. McHutchison is known fondly as Lindy. Lindy, we're so glad you're here.
Thank you.
And there she is, my Lippy Butterfly, Angelique Charles. We're so glad that you're here as well. You're one of the newer members of the lipedema community, but your voice is powerful, and we're so glad to have it a part of our roundtable, our tableless roundtable tonight. So without further ado, we know that we have some wonderful folks that have logged in, that registered. Feel free to chat, feel free to give us your questions and to comment. But I want to get things started because June was Lipedema Awareness Month. I learned a lot because I did a lot of interviews and there were so many webinars. And I want to do a quick around the table review of what's your biggest thing that you learned or your biggest takeaway from Lipedema Awareness Month. And I'll start with you, Pattie. Lipedema Fitness, what did you learn?
I too watched a lot of webinars and participated in a lot of go lives, which was really nice. And one of the things that stood out for me was we started out in our journey of MLD, a very soft and gentle way of moving our lymphatics. And that was really what we were advised to do, and not to go too hard. But now fibrotic tissue has come into play, and they're really talking more about a more aggressive type of massage. So that was something that was kind of an eye-opener for me, and something that I started to work on myself.
That is really an important component, and I love that you brought that up because we have so many people at the table. And Cara, we know that we are going to be losing you because you are super busy, superstar that you are. So I want you to unmute yourself and tell me what your biggest takeaway was from Lipedema Awareness Month.
I think my biggest takeaway is just that we are a community thriving for answers, and that we are starting to demand it. We're not just sitting back casually anymore.
Oh, it's so true. This is how I feel the momentum. I don't know if the rest of you do, but I feel the momentum among everyone. Sort of this, like, we're not going to take it anymore. Nobody's going to put baby in the corner. We're going to get answers, and we're going to keep fighting until we get answers and get help. I love that, Cara. What about you, Cheryl? You had a challenging month, and yet thank you for joining us. You know,
Thank you.
We all have real lives. We don't just sit around and do webinars. You know, everybody's really busy. We've got kids, or we've got dogs and jobs and all this. Thank you for being here, Cheryl. What was your biggest takeaway from Lipedema Awareness Month?
I think one of my biggest takeaways was from a webinar that Karen Hertz did Dr. Karen Herbst, and she was talking about how our lipedema fat has a lot of gel in it, and she gave us the name GAG for that gel, and just the idea that it's just so hard for our bodies to move that long chain gel form that's within our lipedema fat. So.
That was interesting. I also wrote down a note: far infrared radiation thermotherapy.
Yeah.
She said that at a webinar, and I wrote it down. I said, I have no idea what that is, but I think it might be important someday. So I wrote it down so I could look up to it. She was such a wealth of information. And Lindy, you are actually in practice with Dr. Herbst.
Sort of. So one of the things that Dr. Herbst and I are trying to do is create a research center with a lipedema center to be able to do some of the things that she has been wanting to do privately. So we are going to start doing investigational studies on the things like this gel that you're talking about. And those protocols are actually in place and getting started and getting organized. And so we've been looking forward for Dr. Herbst to join us part-time. Everybody wants a piece of her. And we're trying to figure out a way that we can incorporate her at least maybe a few days a month into the practice so that we can actually start doing some of these really interesting studies that she's been thinking about for a long time. So in that capacity, that's our plan so far. We don't have anything locked down. There's a lot of hoops we have to get through, but we definitely have that plan in place, and there's a lot going on with that gel philosophy as well. As far as lipedema awareness, one thing I would like to add is that we actually, my clinic is on a very busy intersection. We put yard signs up, shaped like a pear, can't lose weight. You know, we did a big, during lipedema awareness, a big online campaign with the local TV station. It's one of the best TV stations on their online ads, you know, the .com stuff. One of the things that was very aware to me is the women who learn about lipedema, they are so passionate, and they're driving, they're watching the webinars. They are so excited. They want to encourage people to more research. It's sort of hashtag lipedema too, you know. We want to be part of that. We want the CDC, we want the FDA, they want people to recognize us. One of the things I learned, it's really hard to teach people that they have lipedema. Even when you say, I'm pear-shaped, lipedema, can't lose weight in your legs, lipedema, bruise easily, painful tissue. It's really hard to break that barrier down. Women are still blaming themselves, and it breaks my heart. So one of the things that I actually learned in Lipedema Month is how hard it is to teach everybody, no, wait, you do have a problem. You know, so we're really working hard on lipedema awareness here in North Carolina. And I love the ones that find out, boy, they're ambassadors, they're full blown, they're on board with, you know, hashtag lipedema too. And I love that. I'm part of that team as well. But I want to help figure out a way to help all those other millions of women that don't know about it, that are suffering and blaming themselves.
I love that message. I know that I've heard over and over again from the lipedema ladies, you know, once I saw myself in someone else online, I had my aha moment, and that sort of set me free. But I have got another, here's my main takeaway from, and I'm going to get to you, Siouxsie and Angelique, so I'm coming to you, but here's what I learned. There are a lot of women who do know that they have it and want to get help and can't find a doctor to diagnose them or prescribe for them. And that to me is a hurdle that needs to be surmounted, because I personally have been giving out dozens and dozens of order forms for the product that my company represents, and people don't have someone to bring them to get them filled out so that they can get the help they need. I don't know if you have something to say about that maybe later on, but I want to go to Siouxsie. Siouxsie, what was your big takeaway from Lipedema Awareness Month?
Actually, I'm gonna tag on to what Pattie said, because the thing for me is I'm very fibrotic, and I'm like your typical very nodule-y lipedema. And when Dr. Herbst originally diagnosed me, I had been very aggressive in trying to lose weight and do other things. And I really felt like I should be moving the tissue, but there was this, you're fragile and you need to be gentle, and MLD is almost feather-like. And I was like, oh, okay. And every once in a while I'd break the rules and get a massage, and then I'd bruise, and I would be like, oh, I should know better. I shouldn't have done that. This is what I get. And then when she went over the quadrivis therapy study, and then I watched her video from the FDRS conference where she actually shows it and goes over the results, I was floored. And so I was like, okay, I'm going to start actually massaging my body. And I'm noticing a difference. And, wow. And just from that is still, my mind is blown. I'm still researching and finding out more, but that for me was huge.
I'm so glad you dovetailed off of that, because that keeps coming around again. And I'm going to just go to you, Angelique, if you could unmute yourself. And we want to hear from the Lippy Butterfly. And if you don't know what that means, you've got to watch the interview I did with her. It's on our Lipedema Ladies YouTube channel. It was just inspiring. We're so glad you're here with us. Lippy Butterfly, Angelique.
Hi, thank you.
Hi, what was your biggest takeaway from the last month?
Well, I am kind of new to the lipedema community. And so June was my very first month really kind of getting involved with other ladies in the community. What I learned was that there's a wealth of information out there that I didn't even know existed. I'm learning so much in Cheryl's group about food intolerances and things like that, fitness. There's people out there that suffer from the same thing that I suffer from, that have already gone through some of the things that I'm going through, or going through them at the same time. And there's actually information out there where there might be lack of knowledge with some of the doctors so far still. There are women out there, and there are doctors out there that actually understand what we're going through, and they're actually making headway in getting us help.
I was so touched in your interview, Angelique, where you did meet someone, the self-avowed lymphomaniac, Dr. Andrea Brennan, and she helped you get to a place where you were no longer needing to be in the nursing home. And looking at you today, it's like, oh, come on. This woman is so full of life and energy and so much potential. I'm so glad that you are smiling and shining the way you are. So
thank you.
What's the deal here, Dr. McHutchison? Lindy, why is it such a hurdle to surmount for women to get a diagnosis?
I think that since it's an old diagnosis, right? It was described 75 years ago by Dr. Hines and Allen in Mayo Clinic. However, it's only been gaining recognition over the last several years. And usually when it comes to conditions, if there's no treatment, nothing you can do about something, there's really no reason to have a diagnosis for it. And so I think that's what the whole issue has been. Generally, we're not taught about it in medical school. Once you graduate from medical school, it's really difficult to learn about new conditions as they come up. It is very well discussed in the vein and lymphatic medicine worlds, but it's not really discussed in the family practice internal medicine world. So gaining awareness for these new conditions, unless they have a national appeal, is very, very difficult. So I think that's the number one thing. And changing the mindset. You know, doctors just tell women whose body volume is elevated to diet and exercise, and changing their mindset and teaching them is very difficult. And you have to find open-minded people to do that. So I think it's a combination, it's multifactorial. And I think that if we can get to this knowledge level at the board exam and at the board levels of internal medicine, general surgery, family practice, I think it would be better, but we are gaining. I'm so impressed to find how many people want to refer people to me who at least have heard the word. So we're getting there. but it's a long road for us to sort of chisel away at.
So we shall chisel away. And I know that all of you wonderful influencers that are at the table asked your followers on your social platforms for questions that were on their minds that we could pose of Dr. McHutchison, our friend Lindy, and candidly, we may not have all the answers, but we at least are going to pose the questions. I am going to start with a question from our audience, though. Diane Langford said it's especially difficult for women who are within normal weight, I suppose, to get a diagnosis. And I did an interview this past month with a woman who was 5'8" and 140 pounds, and she has lipedema. And so it is, even though we think about the traditional pear shape and coupled with obesity, it's really not a one size fits all, is it, Lindy? Or anybody else, weigh in on this.
I'm happy to take that. I've seen 2 patients in the last month that are what they call small frame lipedema. These women were under, 130 pounds. They were tiny, but they had, I'm sorry, the dog, I've got to go put him away, but they do actually have all the other factors of lipedema on the physical exam. They have nodularity. They have the things with the dysautonomia, the cold toes. They have the livedo reticularis. They, even though they're absolutely tiny, they still have these fat pockets that they have never been able to get rid of. So I do think it's a continuum. It's a big gray zone. There's not a definite, you have to have a BMI of so-and-so to be it. These factors happen early. It is progressive in some women, but some women are able to control some of the actual volume aspects through diet and exercise early on, or maybe their genetics, we don't know. But it is definitely small frame to large frame. It is a big gray zone, and it's a giant continuum.
And so there is room for you and help for you. Cindy Connell, I think I'm pronouncing your name correctly. She said, yep, that's me. And Diane Langford, you are part of the community. We want to encourage you as well. Pattie, I remember back when I first talked to you, you had been told that exercise was a negative thing, that lipedema women should not exercise. And with that kind of misinformation, you're like, I'll do anything not to get worse. I think that that is a common feeling among all of you. You're nodding your heads, aren't you? Yes, I'll do anything not to get worse. So you were very brave. And fortunately, your partner is a CrossFit trainer, so he was able to help you breach that misinformation and actually become active. You just had your triathlon, didn't you, virtually this past month?
Yeah, in June.
And that's a great accomplishment. You're raising awareness for lipedema. You asked your followers what was on their minds and what would you ask of Dr. McHutchison, and there was an H word that came up.
Hormones.
Everybody wants to know about hormones. Lindy, what about HRT therapy? What about those kinds of protocols?
So this is one of those where we have a lot to learn, okay? I mean, clearly estrogen is involved. It's a female disorder. Is it estrogen receptors? We don't really know. We know that estrogen is involved because most of the men who have it, or are not very common, have estrogen disorders in general. We also know that when there are the hormone changes, the puberty, pregnancy, perimenopause, those are huge hormonal changes. And so there's all this flux going on. And puberty is basically, perimenopause is puberty in reverse. So it's getting everything started, it's everything winding down. And there's more than just estrogen. There's other hormones involved in that whole hormonal axis. We have a lot to learn. So I am sad to report that we don't know all those answers yet. It's a lot that we want to look into. And those are on the slate for things to look into. I think is when it comes to hormone replacement therapy, I have to look at it. Remember, I was a gynecologist, and I guess I still am. Now I'm vascular lymphatic medicine, and lipedema merges my worlds. As far as hormone replacement therapy, I think it's so individualized, and you have to actually look at the person. We used to globally recommend it for everyone. Then we stopped recommending it for anyone as these studies have come out, and now it's really individualized. If someone is their quality of life because their hot flashes or they're miserable, you need a little bit to take the edge off. So I think every single person has to be individualized. If you're a small frame lipedema or a medium frame lipedema and you're at risk for osteoporosis, then perhaps you may need some estrogen to help some of that of your osteoporosis. So for hormone replacement therapy, can it make it worse? I think I'm going to just go out there. Yes, I think it can trigger some stuff. However, I think that quality of life is also important. You've got to get your sleep. And if your hot flashes are keeping you up, we know that sleep is so vital. So I think it has to be really, you have to walk the fine line, be on that seesaw, weigh your risk benefits, get as comfortable as you can, and just make the best decision for you, not just as a female or a lipedema patient in general.
And I've seen a lot of nodding heads. If anybody wants to weigh in on that, I will say that I have learned from more than one of these amazing women, listen to your body. And it's not one size fits all, and do what feels right to you. Some people choose to go the path of surgery. Some people do other things. We've got so many different protocols that people use. But my friend, Pale Ginger Pear, is going to be leaving us shortly because, you know, she's doing documentaries and videos, and, you know, she's a superstar. I'm just teasing you. You know that, right?
Yes.
Okay, good. I want to thank you for being here. And if you want to say anything or ask anything of the doctor before I know you have to leave us, I also know that you have been using pneumatic compression this past month. And that's a great point because, you know, a lot of people don't realize that you chose the path of surgery, but your doctor actually prescribed pneumatic compression, the Lympha Press Optimal Plus, as a protocol to help you post-surgically. So do you want to talk about that for a minute, or anything else you can ask the doctor?
Well, I do agree with her comment about until it kind of becomes a national thing, doctors aren't going to care. And that's why I'm really hoping that my surgeries being filmed and the show being out there will get it in more women's eyes that don't have social media. And then we'll be like, oh, or even if, you know, grandma sees it and sees it, oh, that's my granddaughter, she can then say, hey, why don't you look into this? Because we all know grandmas will do that. They will come to you with this piece of paper that they have something on. So I'm really hoping, that's why I've been so transparent with my surgeries and everything, is to get it out there to another group that hasn't seen it yet, hasn't known. But I have been using the Lympha Press now for a little over a month, and I've actually rearranged my bedroom so that the machine part of it is always on my nightstand beside my bed. I bought a special basket to hold my pantsuit part in so that I have no excuses to easily pull it out and use it daily. Because I know myself, if it becomes too much work, I won't follow through. So I have made it so that I cannot slack off, because I do know that I am extremely blessed to be able to have these surgery opportunities. So I want to do every little thing I can to get the best results. And right now, with everything shut down, manual lymphatic drainage massages is not available in my area. You can't go out and be touched by people, so it's not an option. So this Lympha Press has been a blessing, because I've been able to still do, you know, a drainage therapy at least once a day, if not multiple times, and, you know, kept my legs down. I can feel the difference in my hips post-surgery. Like, one of the weird milestones, I guess, was I fit in my tub without having to angle. Like, I can sit in my bathtub without having to angle a hip up over, And that
Aw.
was the weirdest feeling. And it took me a minute. I was like, wait, both hips are under the water. Like, it was weird. But, I mean, it's
Our
one of the little
hearts-
things.
Our hearts all swelled with you when you shared that story. I think that's marvelous and wonderful. And really what we love about you is your transparency. You do just share from your heart. It's always authentic, and we know at some point in the next few minutes you're going to go black on us here and
Yeah.
we'll lose you, but we thank you for joining us for the time that you could be here.
No problem.
So, you know, one of the things that you had asked Siouxsie was about dry brushing. Do you want to unmute yourself and talk about dry brushing and your question for Dr. McHutchison?
I mean, it was cute because she actually emailed me a little bit, replied, which was great. Yeah, I mean, there's a lot of questions about dry brushing that people have. And I think that it's, I don't think it's completely understood in the lipedema community of like how it actually helps and why it matters. I know that Dr. Herbst mentioned something about the skin being a lymphatic, part of the lymphatic system, the actual, anyway. So there was a question about that. So I was wondering if you could elaborate on that.
Inquiring minds want to know, Dr. McHutchison, and if you can unmute.
Okay, so I will let you know what I know. So the lymphatics are actually, they follow the venous system, and they are actually under the skin. I mean, they're all the whole body, but, and I think the deep quadrivis type, deep therapy, that really does help break up the fibrosis, but the soft, feathery lymphatic drainage that we're, you know, some of the patients say, oh, they're just moving my skin around. You know, I don't feel, that does actually move the lymph. And so the dry brushing is actually to stimulate the lymph channels. And it is just another modified form of soft lymphatic drainage or just soft rolling. And anything you do to just move it along, it's like milking it along, getting it into the larger system. The smaller lymphatic channels do not have a lot of musculature to squeeze it through. So you can dry brush it in from the smaller channels into the larger channels. And it's just more the milking and the soft massaging into it that helps. Anything you do, anything, moving your arms, smooth brush strokes helps. So I'm sure there's somebody out there who's got a lot more knowledge about dry brushing than I do, but I am very supportive of anything that just moves any fluid up distally, proximally, far away, close. It all helps.
So then I'm going to go to Angelique's question, because you had emailed me and said that because fibrosis is an issue, because does that obstruct the fluid from being able to leave the body? And boy, am I, oh yes, let me just do my disclaimer. I am not a medical professional and I will butcher the words as I try to explain. In fact, Angelique, why don't you ask your question? You could do it way better than me.
My question is really more about, for those of us that do have from fibrotic areas and have been experienced decreased sensation in those areas, is it reversible? And do you know what modalities we can use in order to help increase the sensation in those areas that we don't have feeling?
Okay, so first, it's sort of like understanding what fibrosis is. And like if you cut your arm, this is what I tell my patients, if you cut your arm, there's inflammation, then the fibrotic networks get started to do the repair, and then it turns into a scar. So fibrosis is sort of the process, and fibrotic tissue is the process of scarring, and it's the result of inflammation. So if you don't have inflammation, there is no fibrosis. So where you've got the fibrosis is areas of inflammation. Fibrosis then causes thickness, okay? It can cause also what's called induration, which is a thick tissue where the cells of inflammation And the cells that set up the fibrosis come in there. And all that crowding of tissue makes it thick of the cells. And then when the fibrotic strands start to happen, there's it's like a scaffolding that happens before the scar formation actually sets in. So if you can imagine all of that happening, lots of things can happen. If a nerve is going through that fibrosis, the nerve can either be turned on, which causes more pain, or the inflammation can actually turn a nerve off, which would decrease the pain. Now, there's lots of types of nerves. There's muscle nerves, which are called motor nerves that move muscles. And then there's sensory nerves that cause the sensation. And it's those sensory nerves that can go through the fibrosis and either be turned on or turned off, okay, depending on how thick that fibrosis is. Now, as you remove the inflammation in the fibrosis, it'll remove the inflammation on the nerve, and the nerve usually gets better. That's why a lot of this breaking up the fibrosis makes this area feel better. So there's no question that breaking up the fibrosis is critical to helping get the inflammation out, helping decrease inflammation of the nerve, that turn on aspect of the nerves to settle them down. The nerves that are settled down too much, that maybe turn off and called the numb sensation, can they return? Sensory nerves usually regrow. They can re-establish themselves. It takes a very long time. So once you get that fibrosis and inflammation gone, it may come back in a month, it may take a year, but the sensation usually can return once that inflammation and that fibrosis is gone. Now, it may not, but there's been many times that I've seen in the past, even in my own situation where I've done things like accidentally cut the tip of the pad of my finger off cutting an onion or something. The sensories do grow back, or in my vein patients, they do come back. So I think the whole ticket is decrease the inflammation, decrease the fibrosis, and then you give everything a chance.
Wow. Great answer and great question. And we have some great questions coming in from our audience as well. And I promise you I'm going to get to you. First, I want to go to the camel question from my friend Cheryl Scoledge. I asked all of these ladies, send me your questions so, Dr. McHutchison can look at them over. And I'm like, what? Cheryl, you have to explain this one.
Well, a couple of the admin for my group, we were talking and throwing some things around, and we said, if people talk about lipedema holding on to all of this water, and camel's humps hold on to a lot of water and are considered fat. Is there any kind of relationship or anything that we could possibly learn if we studied a camel's hump? So that's super interesting. And, one of the reasons we think that the lipedema tissue holds on to so much water is one of the reasons. We think a lot of reasons. One of those gags that we talked about with that protein gel layer. Yep. Another is that, the sodium content in the lipedema cell and around the lipedema cell is higher than normal adipose tissue. And sodium, of course, holds on to water. So you've got that sodium issue going on, which is probably related to some of this lymphatic movement and all. So that's one reason why we think the lipedema tissue holds on to water. I do not know if the sodium content of the camel's hump is higher in the camel hump fat. It'd be a good question to ask. I suspect that it is not. My guess is it's not. And the reason why is the hump, we learned this in medical school, is full of fat. It's more like a backpack of extra nutrient for the camel when they're out there and they can't get it. We also know, we're taught that the camel evolved over time. And this is coming from my archives, but the camel's kidneys hold on to water and don't filter water the way we do. They've evolved over time. I know that they can lose more water than we can and tolerate dehydration more than we do. So I think it would be a really good question to
ask, because that hump certainly does act like lippy tissue. I think the camels can access it if they need nutrients, where the lippy tissue is not always, it's like, you know, that stingy bank that won't give your deposit back. But it would be certainly interesting to know if we can grab some camel biopsy fat. I'll ask Karen Herbst if she will add that to some of our studies if we can get our hands on it, because it's good food for thought.
You know, it sounds funny, but oddly compelling. So I'm all about it. And I have to say, when you posed your question, Cheryl, you were saying that some of the women in your group have gained 30 to 50 pounds within a single month. And the only thing I can say is how my heart goes out to them. And my heart goes out to every woman facing lipedema and walking this journey. And again, our whole point in doing these webinars, the YouTube channel, every one of these amazing ladies' platforms is about helping this community and linking our arms together and finding answers and solutions. And who knows, maybe the camel will hold a solution for us in the future. It remains to be seen. I am going to, there is a question about exercise, and Pattie, maybe you could speak to this as well. Sandy talks about wanting us to address exercising with and without compression. She wears a certain kind of compression that covers from the toes to her breastbone, and it's awesome, except for the constricted breathing. So is she better off not wearing the compression to enhance her breathing? Any thoughts on that, or any thoughts from anyone on the panel about that? But you're my fitness expert, so I thought I would ask you, Pattie.
From my experience, I couldn't do the kind of activity that I do without compression. Like, I add extra compression. Normally, like during the day, I'll have on my 30 to 40 grade knee highs, and I wear those pretty much from when I wake up after I do my self-care routine. That's the first thing I do, is put my compression on. When I do my workouts, I add another layer that goes basically to just under my sports bra. And I get what she's saying about the inhibited breathing. It sure does play a part, especially like right now when it's really hot where I'm at. And I have to modify what I'm doing. I couldn't take off the compression because I would immediately start to swell. So for me, it's not a good idea to take it off, but she may want to look into maybe another type of compression that maybe isn't so, you know, high up on her area, or is maybe a little lighter grade. Like the, I use the BioFlect with my lower leg compression, and the BioFlect is much less, you know, the knee highs are 30 to 40, but the BioFlect I think is like 12 to 15. It's really not enough compression for me. I should be having a more substantial compression, but to be able to squat and, you know, do the type of movements that we're doing, I need a better range of motion than I'm able to get in some of the heavier grade compression.
Mm-hmm. Good point. And if your breathing is labored, then back off.
Slow down. Yeah.
Yeah. All right. So that was a great answer, and it's an excellent question as well. There's a question here about, and oh, don't we always wish that there was a magic bullet, a one-for-all diet protocol to clean the system. Victor Rennell asks, is starting the nutrition cleaning of the immune system to reduce the swelling reactivity by using the autoimmune diet protocol a good start? I bet, Cheryl, you know the answer to this question, and anybody else who feels like weighing in, go for it.
Well, what I would say is that I've known lippy women who have basically any diet out there. I've known women who have done well on keto, on carnivore, which is kind of on one side of the spectrum. I've known women who have done well on whole food, plant-based, so vegetarians, and the whole spectrum within. To me, my belief anyway is that inflammation that Dr. McHutchison was talking about earlier, that inflammation is from a food sensitivity. We were talking about menopause a little bit earlier. I know for myself that my food sensitivities have gone out of the roof since I hit menopause. I mean, I am reacting to nearly everything now. Whereas I used to have an iron stomach and I could eat anything without any problems. And now, I mean, I'm just reacting to everything. Wow. So my thought is that the diets that are working for the Lippy women are ones that just happen to cut out the foods that they were sensitive to at that time. So that's my thinking. And I could be very wrong, but I do have a lot of women in our group who are kind of doing tests on themselves as well. And they seem to be saying the same types of things, that it's really working out for them to figure out what those sensitivities are and get rid of those foods, at least temporarily.
So I see you nodding a lot, Siouxie. Did you want to add something? I mean, your neck was going to just pop off there. So go ahead, tell us. And then Angelique, I know you're into food and cooking and all that too. So if you want to talk about nutrition, go for it. But Siouxie, why were you so nodding?
Well, just because when I found Cheryl, I found her group when I was, I was looking at the FDRS videos, and I saw hers on food sensitivity, and it was like an aha moment, but she didn't get to finish her whole talk because she only had 20 minutes, and I knew there was more, and I was annoyed because I felt like she was going to say something compelling. And then I stumbled across her Facebook group, and then in there I could see the rest of her talk, and so I was so fascinated. And I did the sensitivity test recently, and I found that there were certain things that my body was definitely lacking in, but also, like, even though I was doing keto and intermittent fasting, I found that dairy is like absolutely terrible. And not just dairy, but like even sheep's dairy. Like I was like, okay, A2, A1, I know I'm going to confuse some people, but there's different proteins. So I was like, oh, I'll just do the A2 proteins because that's what the bodies are meant for. And I was like, yeah, no, my body was like, it created a whole bunch of lippy pain that was, I went from like a 7 to I'm probably now like a 3, 4. Like this is the most no pain that I've had since I've hit perimenopause. And it was just the dieting. Now I am swimming every day and doing my pool exercises and stuff, but the main thing was the dairy and then a couple of other things. So I think that is, the inflammation is everything. That is really, truly it. And I don't know what it is for each person. Some people do great with dairy. So.
And if I can jump in again, there's someone in my group who was just telling me that their granddaughter made them a glass of water with lemon and mint. Now, who would think that that would be any kind of problem? Anyone. And she swelled. It's from the mint. She is sensitive to mint, and she swelled immediately after drinking that water. So.
Wow. Well, I'm still recovering from your scallop story, Cheryl,
Yeah.
where she had one scallop and gained 5 pounds. I'm like, I'm never seeing a scallop again as long as I live. Pattie, you were nodding too when people were saying about different dietary plans. I mean, your lane, your expertise is fitness, but how does diet incorporate into your protocol for managing your lipedema?
I actually just got my results back from my hair test. So when she was
We've
talking,
all contributed hair in the past month, thanks to Cheryl. Have you ever, Lindy, have you ever done a food intolerance test? Oh, I've got 5 pages of stuff I need to avoid. So go ahead, Pattie. What did you learn?
Yeah, I basically, everything dairy, every cheese, every type, cow milk, sheep milk, goat milk, all of it is just bright red, highly sensitive to that type of food. So I'm in the process now. I get really excited about trying to work out new ways of dealing with this. Like I did that with fitness, and I've done that, you know, I've been keto and intermittent fasting and all that. And I've never gotten the kind of responses that a lot of other women get with lipedema and doing those types of diets. And in my test, I can have, you know, I have no sensitivity to wheat. I have no sensitivity to all these things that I've not been eating, but I've got this huge sensitivity to dairy, which, you know, I would be a block of cheese if I could because I love cheese. But I'm excited about it. I like to plot it out. And so instead of looking at all the stuff I can't eat, I'm really going to focus on all the stuff I can eat and what kind of recipes I can make with those foods that are, you know, not sensitive to my system, and see what happens. You know, I'm going to do a big blog. It's going to be every week. I'm going to kind of talk about what's going on and my results, and it'll be a little experiment.
Well, I just think you've just underscored something. You know, you were told stay away from wheat, and wheat's not your problem. So have some fun with wheat. Have that wheat pasta, Pattie. Have a blast with it. Angelique, I know food has been a really big part of your life, and cooking healthy. You blog about it. You post about it. How has that helped you face your lipedema and sort of surmount the challenges?
Well, I'm on the same journey as the rest of the ladies. I just got my Ziploc baggie today so that I can mail off my hair sample and find out what my sensitivities are, my intolerances as well. For me, I had been on the journey of just trying to figure out, just like everyone else, what was going to actually work. I had tried the 6-week body makeover at one point. I had tried keto. I had tried Weight Watchers, just anything that you could name, and it didn't seem like it had worked. In addition to actually having weight loss surgery and not being able to eat many calories at all. But I did notice that one thing that came up over and over again was dairy. And I am a cheesehead, like it seems like many of the other ladies are. So it's something to look into, those sensitivities. I did notice that when I wasn't eating as much cheese, just off of trying to cut down on certain items, my swelling decreased substantially. So it really is something to look at, the sensitivity that we have. And then, like you said, celebrating what we can eat. Maybe I can eat wheat once I get my results back, and then, or hopefully potatoes. I'm hoping that potatoes can be
Yes, let there be potatoes.
No potatoes.
That was a great
Can
comment.
I eat red potatoes?
I think well, we're all, I'm a foodie. I love food. My problem is I'm on Weight Watchers right now, and I think 0-point foods are like they never total up to any points. So I overeat my 0 points, and eventually they end up being points. But that's another story for another day. Question from Joy Barnett out there saying, would taking an at-home food sensitivity test that you can order from the internet be beneficial? And I think many of us here have done it. And the answer, yes, it was beneficial. Cheryl, do you have a recommendation for that? Do you have links from your website that you can send people to?
Yes, if you would join my group, that'd be awesome. There is a link in my group. I've talked to one particular company called Check My Body Health, and I have a special link with a special code for us Lippy ladies. So with the link that I have, you're able to get an additional $5 off whatever promotion they're currently running. So extra $5, that's always good. So feel free to join my group. Lipedema and Food Sensitivities, take control of your lipedema.
Yes.
That test is also on sale right now for the next couple of days. So if you get in there, you can get it done for
Wow,
very
we
cheap.
should have had them sponsor this broadcast tonight.
Yeah, really.
I want to go to Dr. McHutchison for this question. Can you compare the benefits from dry brushing, vibration, pumps? Is there a preferred order? Can you speak to that?
I cannot speak to it except that I can say they all work.
Okay.
And so when it comes to the pumps, I prescribe a pump for almost every single new diagnosis for lipedema, even if they are, stage 0, stage 1 lipedema patient. Bottom line is, I tell them I don't want you to be prisoner to the pump. You have to work it into your lifestyle when you're sitting at your computer, when you're, figure out a way to work it in. And I think everything works. So you have to figure out how to make everything work and use them. If you can dry brush, even if you're like sitting in the car and you're at a stoplight, you can dry brush your arms. You can use a vibration plate if you're sitting at your computer, if you're watching TV. So I don't think that one is better than the other. I think they all have different functions for different times. I mean, the pump's probably the best of all of those three, but you have to stop and do it, put it on and apply it and turn it on So I think that just figure out how to work them all into your lifestyle during certain parts of your life, because they all serve a function.
And, I had a wonderful interview this week with my friend, Nita Cluis. Nita, I know you're out there tonight. I've learned so much from you. And she considers managing her condition just part of her life. And she may spend hours a day managing it, but it's worth it to her to live the best life she possibly can. And that's why you take these different measures. And, I know that you talked about your food test, and I want to encourage anybody out there watching, if you want to know about the Lympha Press Optimal Plus, I would love to walk you through how this compression pump can make a difference in your pain and increase your mobility. So please do private message me, bviola@medsoulsupplier.com. I would love to talk to you about it. I'm so excited because we still have 10 minutes and we have a few more questions. Question from Jeannie Proctor, probably for you, Lindy, but let's see. I've been wondering if there is a correlation between ER plus breast cancer, I'm sure I'm saying that wrong, and lipedema. She was diagnosed with both 2 years ago. She's now taking an estrogen blocker to reduce the occurrence. And as a result, she's been able to reduce her weight and size of her legs much more than ever before. Ooh, this goes back to the hormonal question, doesn't it?
Yeah, so I'm sure the question was ER/PR positive, which is estrogen receptor, progesterone receptor positive.
Well said.
With the breast cancer. I'm sure that's what it's about. And I'm sure she's talking about the estrogen agonists that they take to like raloxifene and stuff that actually block the receptors on certain tissue, and they actually can stimulate it on other tissue. And so I think it goes back to the fact that we do know that their estrogen is involved, that estrogen receptors are involved. We don't know how, and the fact that these estrogen receptor medications, these estrogen receptor blockade medications, it sounds like the one she's on, for the patients that have estrogen receptor positive cancer, we want to block those receptors to stop the promoting it in those tissues, but it can also promote it in other tissue like the uterus. So there's so much for us to learn. We don't have enough information, but that's certainly, I'm going to add that to my list, because we have lots of patients that have breast cancer, that have lipedema, and it's this anecdotal information that helps drive our solutions and drive the questions for us to answer. When patients say, oh, like Cheryl, I ate scallops and I swelled 5 pounds overnight. I was there when you were giving that talk, and I was like, wow. And then to have this patient say, I took these estrogen receptor blocker medications because I have ER/PR positive breast cancer and I got better. I mean, we have to talk, we have to share that information in these forums so that we can ask the questions and we can answer them. That would be a great question, and I'm just going to add it to my list because Karen Herbst and our list is just growing of things we want to do, and we're planning to do them all.
And do you know, we are all cheering you on.
Let's hope.
Seriously, we are in total support of the amazing work and the research you're doing. And we're so glad because we know you'll share everything you learned with us. This question that came in, I think might be really good for everybody at the table to answer. What is the best way to educate our caregivers about fat bigotry that may get in the way of them truly diagnosing lipedema, lymphedema, and Derkums? I think that many of you have shared that you had to surmount that bigotry to get to your own diagnosis and get to your own help. And I'm also interested in your response to this, Lindy, from a clinical perspective. How should patients approach their doctors and practitioners and therapists about this condition? I'm going to start with you, and then I'm going to go around the table.
So we actually send an article, we send an information to all the doctors that the patient, in fact, it was the article that I did for the Lympha Press almost a year ago now.
You were one of our thought leaders, and you did a great article that is on the Learn website. People can access it. Just type in Lindy McHutchison and her article will come up. It was really brilliant. So,
and it was Brenda that sort of inspired that whole article to be written. I actually send copies of that. What I like to tell patients to do, instead of going to their doctors and say, could I have lipedema? Instead of a question, which is going to put them in a sort of, a one-up, doctor knows it all kind of stuff, is say, I heard about this condition, I think I have. And a proactive, I think this is me. What do you think? Do you know about lipedema? I am so excited. This looks like me. It sounds like me. It feels like me. I can identify with this. What do you think? And that puts it in a whole different light to make them or encourage them to go learn about it, because they go, well, I don't think you do. Well, do you know about it? Well, no. Well, then how can you say that? So rather than approach it in a, well, do you think I have? I would say, no, oh my gosh, this feels like me. It sounds like me. It looks like me. If it is a rose, it smells like a rose, it probably is a rose. And I just tell them to go at it in a more proactive thing. And then I send information to them saying, your patient has this. And I make them tell me all their doctors, their endocrinologists, their cardiologists, their rheumatologists, whatever doctor they have in their list, I send the information to them. So I encourage them to go in a proactive way. This is what I have. This is what I think I have. What do you think?
I love that. Talk about walking in empowered. And, I titled Pattie's interview From Victim to Victor. That's the shift we all want to make, from victim to victor. So surmounting this fat bigotry and approaching your medical professionals, you gave us a great springboard, Lindy. So I'm going to go to you next, Pattie. Any advice for our participants out there?
Absolutely. I brought a ream of paper that I had gone on the internet and printed out articles from Dr. Herbst and anybody else I could find, and brochures. And one of the things that's recently kind of come up that I kind of stumbled upon, because people are asking their doctors about it and they're getting told they could do a blood test. And I'm like, well, wait, there's no blood tests for lipedema. And what they're hearing is something called lipedemia, which is high cholesterol. So that's why they're like testing blood. So even when you're able to say, I think I have lipedema, some people, like in Europe, they say lipedema or, lipoedema, and they kind of change how they're saying it to try to clarify. So it really is about you standing up, and you may have to fire a few doctors. They work for you. So if you aren't getting the care that you deserve, try somebody else, because it's so important to have the support of your medical provider. How can you even address anything medically for yourself if they're not even willing to listen about this condition? You may not find that they know about it, but at least if they're open to learning about it, it's the right, a step in the right direction.
Great advice. And I want to stay true to our time, so I'm going to run to you next. Siouxsie, how would you answer that question? Approaching your medical professional and surmounting fat bias.
I mean, honestly, I've been told that I'm morbidly obese at every doctor appointment after they weigh me and whatever, and I don't really care. I don't think I'm the right person to answer this, because I literally got diagnosed with Durkheim's disease, and that led me to Dr. Herbst. And then she said, no, you don't have that, you have lipedema. So I didn't actually encounter that. But I would say, and this is what I tell people, is to do what Pattie said. And you can go to lipedema.org, and there's so much medical backed up information that you can take with you. Okay.
So good. Excellent. And you can find a provider too on the Lipedema Project website, which is great. Angelique, the Lippy Butterfly. How do you surmount the fat bias, the bigotry, and how do you get heard?
My story is similar to what Pattie was saying. You know, it's okay to go ahead and fire your doctor. If you're getting the wrong answers over and over again, if you're repeatedly getting misinformation from that doctor, it is okay to get second opinions or find a doctor that is willing to work with you. Even if your doctor doesn't know about lipedema, if they are open to doing the research, if they're open to getting an understanding, we do know that there are some doctors that are a little bit closed-minded. It's okay to fire those doctors, but the important thing is for you to get what you need for yourself to get better. You don't stay with a doctor just because you're trusting their word. If you know that something is wrong with you, you keep going until you get the right information and the person that's going to actually work with you and your body.
I just want to say amen. I love that. And so, Cheryl, any parting words on this topic before we close out tonight?
Sure. But one thing that a lot of lipedema ladies have is an issue with blood pressure and blood pressure cuffs. I spoke with Dr. Herbst at FDRS a couple of years ago, and she said that an automated blood pressure machine will push the fluid out of the veins and into the interstitial spaces, and it immediately will spike your blood pressure. So what I do is I made up a little card. It's a kind of a fake card, but it says, I have lipedema. I cannot have automated blood pressure machines. And so I have that card, and whenever I go to the doctor, I hand it to the nurse, I hand it to the doctor, and I have it in all of my medical records that I have lipedema. I've just written it on everything. So that's
great advice. Great advice. We didn't get to answer everybody's questions, but I'm hoping that I can have you all back again, maybe next month, and we can do this. The hour goes by so quickly. I want to honor you, Dr. McHutchison, for your work. You care. You care deeply about the lipedema patient population, and you've devoted your resources and your time and your energy and your brilliance into it. And we applaud you for that. We thank you. We need more Lindy McHutchisons out there.
Well, it's a team. I mean, we all have something to bring to the table, and it is a team. It takes a village, and I appreciate you saying that. But everyone in this roundtable, everyone who's joining this Zoom meeting today, it is a hashtag Lipedema2 project, and we all care, and we all have to do our part to bring this awareness and bring it, like Karen says, Karen Herbst, the cause and the cure. And that's what we all need to work for. And that's what everyone who's passionate and ambassadors are doing. So thank you, but thank you to all of you as well.
Yeah, and I also want to say, since nobody's going to cut it off until I hit the stop button, I'm going to say this. Thank you so much for our audience showing up tonight. I know it takes time to register and be at an appointed time. You could always watch the replay, but your energy, we felt it. We felt your questions. We felt your love. We even had our friend Camiella out there, formerly of The Bachelorette, who is a lymphedema ambassador. And thank you for being with us tonight, Cam, as well. And what can I say? Pattie Cornute, Lipedema Fitness, Siouxie Boshoff, Lipedema Living, Angelique Charles, the Lippy Butterfly, our dear pale Ginger Pear, who had to leave for some exciting venture, Cheryl Scoledge, Lipedema and Food Sensitivities. You are marvelous, and I am honored to work with you. I adore you, and I hope we'll continue to tell many more stories and help many more women. And to that I say to all, a good night. Good night, everybody.
Bye.
Bye.